Thanks for the opportunity. My name is Dr. Edna Tallam-Kimaiyo, and my qualifications, I did Bachelor of Science in Nursing from the University of Baraton, and then I did Masters in Public Health from Kenyatta University. I also enrolled on Global Health Leadership from Afya Bora Institute, which was a collaboration with 4 universities in the US and Kenya. So in particular within University of Nairobi and Washington University. I thereafter also did a global nursing leadership program, which was facilitated by International Council for Nurses under Global Nursing Leadership Institute in Geneva, Switzerland. And finally, I have a PhD in nursing education, and this I graduated last month from the University of Stellenbosch University, which is based in South Africa. I've done various other courses, monitoring and evaluation. I've done corporate governance. I've done innovations courses from the Stitch. I've done women in leadership, financing, and also quality management and quality improvement systems. So my role as an executive director, that is the chief executive officer in Nursing Council and doubling up as a registrar, basically is to steer the organizations in regards of ensuring the mandate is done, the governance issues, the financial aspect, being an AIE holder, and of course working also with our parent ministry in various policies, implementation and that. So I do not have a sort of a model of a typical day it is, but I have a sort of what a plan is and how it is fulfilled. So of course I work within 8 to 5, what is put in our human resource policies, but we work more than those hours. You can start your day as early as 6 and 7, perusing meetings and preparing, and you can even actually have my day even ending at 8 p.m., sometimes 10 p.m. During COVID, I think I worked continuously for 4 weeks, and I actually didn't have, a time frame, and the time flew because we were actually really supporting, the issues of ensuring that we mitigate the COVID within our country. So within the day-to-day, I will really not have how it is. There's what it is written and there's what is practical. So clearly, I'll just say that beyond the NASIC of Kenya Council, the mandates, I have other competing priorities. I have meetings, I have stakeholders engagement, I have policies, and sometimes I have impromptu meetings which are not within the calendar that I actually need to be able to basically fit in. So I'll actually say that as a director, you actually need to be very adaptive to the change, very flexible, and very accommodative to ensure that is done. But I will not have like a schedule of how the day is, but I have an idea of how the day starts. I'm not an early morning. I can't wake up at 4 a.m. I've tried to be a 5 a.m. club, but it doesn't work much. So my day starts at 6, but it ends at midnight. So I squeeze a bit of time towards before I go to the bed. However, I actually have dedicated, I think, the last 2 years to ensure that I have protected time for family and over the weekend for me to be supported. Yeah, because I exhibit various personalities. So I'll say that I'm driven by virtue that I'm energetic and I can be able to be a driven purpose. I have to be able to deliver the goal or the mission or the mandate or whatever the activity. So it's more of an outcome-based person that I am. So I'll say that I'm driven. So clearly, I mean, first, being in a position or a role of an executive director of an organization on itself is challenging because you manage human beings, you manage the human resources that you have, and it is very difficult to manage human resources. In fact, sometimes I'll be like, I wish I could be able to manage animals or I manage plants, because once you plant a tree, which we can be able to see in our background, it grows. The only thing you just need is to put water. But now human beings, you need to be able to deal with personalities, you need to have emotional intelligence, personal relationships. So those are actually the things that I ensure that I have them within my hand. But again, let me just say my background. I started nursing leadership at a tender age. At the age of 22, I was already an in charge of a facility in our referral hospital. But having also said that, I think I also jumped in to an executive position at the age of 32. going to 33, which was a really young age, to be a CEO of an organization. But again, saying that is that beyond the challenges of managing the human resources, leveraging on the limited resources that you have, and trying to ensure that the mandate of organization goes, working with performance management framework, ensuring that you collaborate with other stakeholders, lobbying for finances, ensuring that you work well with, with your bosses, with the board, with also the ministries and the other line ministries, are the things that you need to be able to say that. I'll just say it's really not really a challenge,
Yeah.
but it is the traits and that as a leader you really need to be able to figure out how you'll be able to fix that. Coming to the challenges in the nursing leadership is that at that time as I entered, there was no clear succession plans and more of a support systems and even advisory boards that you will be able to want to go to them and to be able to guide with the professions. And at the same time, because of historical injustices that nurses and leaders had had in regards of their pay, in regards of their working conditions, actually poses a lot of challenges because all those things are brought to our table for us to figure out how to resolve. Yet it's things that we can be able to work it progressively as opposed to that. Other issue is because as a profession, again, we've had a lot of historical injustices within our career and our constituents, the people that we do represent or we do regulate, actually have a sort of a feeling or of reservation that they are not well appreciated, they are not well recognized. So that also poses a challenge to be able to see how do we ensure that we empower them, we support them, and we also ensure that their welfare is well supported through that. Again, as an nurse leader in the regulations is the changing the regulatory frameworks and ensuring that there are laws that you have to abide by, there are circulars and the things that you need to be able to work in. But at the same time, again, is that from time to time, we've never had a pool of nurses experts and nurses leaders that they are prepared for the succession plans, and we've been able to see aging populations. And then nursing has grown, from the certificate to the degree to the masters to having scholars and that. So that has never been appreciated so much to ensure that we are part of the healthcare systems to be able to support that. How to mitigate? I think it's more of advocacy, more of a collaboration. We need to be able to, we have started not talking to ourselves and ensuring that we have a collaboration to talk with healthcare or other workers. We need to talk to other professionals, the gatekeepers, within the parliamentary health committees, the treasury to be able to give us the resources, the county governments. That's actually how we need to be able to do that. And working across all the leaders, being open to be able to be mentored, to be supported, and also to achieve the goals as you move forward. The theme being our nurses, our future is really a well thought theme to come with here. Let me just quickly we reflect on COVID-19 pandemic. And we actually saw that healthcare workers and most so nurses and midwives who are so crucial in supporting and mitigating the COVID-19 pandemic. And having said that, and working towards ensuring that how do we ensure the future, and again, also tying in with the Kenya Kwanza Manifesto and more of the bottom-up, better approach, transformative agenda, is that we need to be able to ensure that we deliver on the universal health coverage, and again, build up on our primary health care and support the tier one, which is the community level and all that things. So nurses are so crucial, and they're the future for these institutions and for the healthcare because we are the one who provides from the preventive care, from the promotive run most of the RH activities, not forgetting that our nurses and the midwives are the ones who are managing our tier one institutions, which is the community, and also tier two, which is our dispensaries. So we just need to be able to invest for the nurses and midwives. We need to invest in the educations, we need to invest in the jobs, we need to invest in the service delivery, and of course, we need to invest in leadership and governance to ensure that we strengthen our nurses and midwives to be in a position that they can be able to influence policies which drive the delivery of UAC and our national priorities as we move to the future. So I will just say Edna the nurse. So Edna, a nurse, the nurse, the animal trail is more of a dolphin, and you see dolphins are animals that, they are adaptive. These are the animals that, they ensure that they are able to be agile in regards of different environments, accommodative, and all those things. So those are the personalities of because the nurses are advocates. We need to be able to advocate for the patients. We need to be calm. We need to ensure that, we are able to work in various aspects. When it's a Christmas, people are celebrating, we are working. If people are in church on Sunday, we are working. When people are sleeping, we are working. So we need to be able to have that agility and agile, and to be adaptive to various environments. The way dolphins can still be on the land and at the same time on the oceans, and that is that. But I, as Edna, I think, the personality type is a mixture of a cheetah and a bear. That I have a lot of energy. I am a bit of assertive, expressing confidence, and a well-driven person, that I have to ensure that a task is done, and I cannot sleep if that thing is not completed, and that is personally me. For the younger generations, and thank you so much, because most of you are actually in school, and I see most of you are actually choosing nursing as your career. So there is bright future for the nurses in this country, as we see the IA, the artificial intelligence, IoT, and even the profession that it can be faced in the future. We are very optimistic as nursing and midwifery profession that some of our tasks can be taken up, but we are still very key to deliver healthcare. So going to the future, this is a profession that it is still there to stay. But at the same time, I'll also say that nursing and midwifery as a profession is, their competencies are transferable. You can work across the globe, and you can be able to work across all aspects, and even tying on various SDGs, including, of course, SDG 3 that we'll be able to ascribe in regards of good health and well-being of the population. But we have a lot that you can be able also to be able to support and also influence issues of the climate change, food security. We can be able to influence availability of water. We can change our environment and environmental health, and we can work on various places from the community level to all the tiers and all the levels of healthcare service. We can work in health financing, we can work in economies, we can work in various aspects. So the future is bright, but at the same time, we as a profession also need to ensure that we give hope to the people that we serve and the clients, and they should be able to have confidence in the services we have, and that is the nurses and midwives, and that is the future of the nation that we own.